Betty, I'm Sarah. I'm your nurse today. We're going to take out your catheter. Is this a good time? Great. Can you verify your name and date of birth for me? Sounds lovely. Now I would explain the procedure to my patient, make sure she doesn't have any questions. While I'm doing this, I can raise the bed to my working level. I've already done so. So I'm going to uncover my patient. And then I would drain the bag. At this point, I could note anything that I notice, output, amount, color. After I've drained the bag, I'm ready to remove. So I'm going to sanitize my hands and put gloves on. And then I'm going to position my client in the lithotomy position again, keeping her covered until I need to uncover her. And once again, if the patient was unable to get in this position herself, I would just ask for help. And I'm ready to expose my patient. Here's where I would provide pericare. I failed to mention pericare in my prior video. I would have done it before insertion. Actually, before I set up my sterile field at all, I would have done pericare on my patient, and then right after insertion I would have done that as well. But anyways, I would do my pericare right now, and then take the tape off of her leg that is holding the catheter into place. I'm going to grab a chuck or something to put under the patient's periaire. This is just going to catch any dribble. So we don't want to dirty the bed, just keep it clean. And now I am ready to deflate the balloon. So with a syringe, I'm going to attach it to the port. And then before I start deflating the balloon, I want to make sure that I hold on to the catheter. I want to keep it in place. So I'm going to hold on to it and let the balloon deflate. Okay. And my balloon is deflated, so I'm going to, with the chuck in one hand, I'm going to smoothly and swiftly, not too fast, remove the catheter. And then after it is removed, I'm going to inspect the end. I just want to make sure that it's intact. Now that my gloves are removed, I can dispose of the catheter in the biohazards bag. The syringe would go into the sharps bag. I would sanitize my hands again. And then I would put on a new pair of gloves. I'm not going to do this in the demonstration, but I would don new gloves to provide pericare for my patient. I would let her know that she might feel some discomfort after removal of the catheter, and that's normal, it's to be expected. I would just make sure that my patient is comfortable, and cover her up. Then I would lower the bed completely, make sure again that my patient is comfortable, ask if she needs anything, give her call light, and I'm ready to go document.
The end.